What's one thing you're afraid of and wouldn't want to do, but deep down you know it could change everything? For many women, that thing is finding out the truth about their brain health. We are scared to look, scared to know, scared it's too late, scared to find out, scared there's nothing we can do, or it's too much to do, or perhaps that it's even too much to think about. But here's what I've seen. The moment you choose to know, the fear begins to lose its grip. And what happens instead? Agency, action, power. I'm Dr. Manna, and I'm on a mission to save women's brains. I'm a naturopathic and functional medicine doctor. Twice in my life, medicine failed me, and now it's my mission to find the truth about health and wellness and share it with you. Lately, everywhere you look, there has been increasing talk of dementia and Alzheimer's. The articles are talking about an impending tsunami of dementia cases in the next couple of decades. I want to be very clear about one thing. Dementia is a disease of midlife. It just gets diagnosed in older age. In this episode, I want to talk about how to screen for dementia today. This is one of the most empowering things that you can do for yourself today. There are many ways to screen for dementia and Alzheimer's. In today's episode, I'm going to cover some blood tests, including one which is very new and you deserve to know about it, and other ones which are simple, non-invasive assessments that you should know about because these can be easily done. So first, the blood tests. The new ones developed by a company called Neurocode based in Bellingham, Washington are actually quite revolutionary. They can detect the earliest signs of dementia before symptoms start. No spinal tap required, no PET scan, just one blood draw. These tests measure 3 key proteins that reflect how your brain is doing behind the scenes. You don't have to write anything down. I have a downloadable PDF in the show notes for you with all the detail you need. So let's get into it. The names are a little bit complicated, so just hang tight with me. The first test is p-tau 217 or phosphorylated tau 217. This marker is a red flag for early Alzheimer's. What happens in Alzheimer's disease is that tau protein builds up and forms tangles in the brain. P-tau 217 is the most sensitive and specific blood marker we have today to detect those changes. High levels of this protein signal early brain changes that could potentially indicate Alzheimer's. This marker can rise way before memory loss starts, so it would be very helpful to know what the level is today. The second test is GFAP, or as I call it, the GFAP, which stands for glial fibrillary acidic protein. This test tells us if your brain is inflamed. This GFAP comes from glial cells in the brain, which is the cleanup crew of the brain. When there's damage or inflammation, they get loud and GFAP rises. High GFAP means brain stress or injury, often tied to inflammation or early disease. Think of this as your brain's smoke alarm. Third, NFL, neurofilament light chain. This test tracks brain cell wear and tear. NFL leaks into the bloodstream when brain cells or neurons are injured. It's a general marker of brain degeneration seen in aging, trauma, multiple sclerosis, and Alzheimer's. High NFL means ongoing brain cell damage. This test helps us monitor how fast brain health is declining. Again, I have a downloadable PDF in the show notes for you with all the information you need. You don't need to wait for a crisis to start paying attention to your brain. You can start with these simple tests that require just a simple blood draw from your arm, and these tests can give you an early readout. Last I checked, these blood tests cost around $800, and my understanding is they're not covered by insurance. Please note that I have no relationship with the testing company. I am sharing information that I feel would be useful to all women, and I will link the website which has more information about these labs. You can potentially also order them for yourself. Patients can directly order these tests too. These are extremely useful tests, but you have to be the type of person who will use the information to take action, but not to stress over. On the other hand, there are other labs that have been around for a long time that you could have your doctor order for you, and these are likely to be covered by insurance. These are simple blood labs like high sensitivity CRP, which is an inflammation marker, levels of vitamin B12, which is essential for nerve function and memory, vitamin D, which is linked to mood and cognitive decline, your TSH and free T3, thyroid hormones that impact your energy, your mood, and memory, estradiol, progesterone, and testosterone, sex hormones that are also brain hormones, homocysteine, elevated levels triple the risk of Alzheimer's, and finally, insulin. Elevated levels are a risk for Alzheimer's or type 3 diabetes, as it's also known. And last but not least, you could also test for ApoE, which is a gene that is correlated with higher susceptibility to Alzheimer's. This can be done through blood test or saliva. I will have all this information in the show notes as well in a downloadable PDF so you can take it to your doctor. If you know someone that could benefit from this info, please share this video with them. Now to the other types of tests for cognition that do not require being poked by a needle. This is a totally different type of option for checking how your cognition or brain health is. This is done via cognitive screening. The first one that I'll mention is called the Montreal Cognitive Assessment, or MoCA for short. This is great for early cognitive changes. A certified health professional administers this test. The second is a mini mental status exam, or MMSE. This is a quick screening for memory and orientation. It's also best administered by an experienced professional. Then there are online assessments like those provided by CNS Vital Signs. I prefer to use this online assessment that lasts about 45 minutes, and you can do this at home on your computer. A licensed practitioner would need to order this one for you. And there are other similar online assessments as well. But this gives you information on how and where to get started if you have concern about your brain health, right? You could get yourself screened for how your cognition is today so that you can take action. Remember, as women, we are at double the risk for developing dementia. So let's take action on what we can do today. Not only to assess brain health, but take agency over our future. And if you have family history of dementia, especially a mother or grandmother with the disease, it is even more imperative that you do the due diligence as soon as possible. One final thing, these labs are not specifically for women, but because my audience is mostly women and I'm on a mission to save women's brains, so I address this message to you, my dear women, my dear friends. However, men would take the same exact tests. There is no gender specificity to them. The info that I have shared with you today empowers you to take action. Remember, again, dementia is a disease of middle age. Brain changes begin during perimenopause and continue to compound into menopause and postmenopause. Often, the diagnosis comes about 20 years later, in our late 60s or early 70s. Once that happens, it can be too late. So the time to take action is now. If you're in California, I can help you with these tests with our personalized precision medicine-based program to prevent and reverse early stages of dementia. I am Dr. Manna, and I'll see you in the next episode.